This is Dr. Gary Tennant. I'm a functional medicine practitioner. I'm a registered nurse and certified in acupuncture. I'm also a chiropractic physician. I'm really happy to present on CBD, cannabidiol, because it's one of the most important breakthroughs in supplementation in the last 20 or 30 years. So I hope to give some information for people so they can learn more how to use CBD and have better health. And let's dig in today's content on CBD and its use in sleep and neurological issues. Okay, so we're going to talk about the ECS, which is called the endocannabinoid system. Now, this particular slide is really useful to understand the potential benefits by using things like CBD as a supplement. And when I use the term supplement, it actually means to add to in the body. So we see this endocannabinoid system in the body. So the term endo actually means within, and then the cannabinoid system. So that's why when we take in certain products, it's going to have a stimulation of these particular organs. So I'm going to highlight in today's talk about the brain, but I just want to show you the other things too. There is the heart, which means this, is that these endocannabinoids are helpful for the heart too. So if someone were to have heart issues, to have some more CBD in their body would be strengthening to that particular organ. And the only reason an organ has a receptor is because it has benefit to that particular organ. So we see some general categories here. We see the nervous system, which is represented by the brain, the heart, so it's cardiovascular. You see several organs of the digestive or GI tract, and that would be the liver and the stomach and the bowels or intestines. We even see kidneys, so that's another organ system. Some smaller systems, the eyes and the teeth, and then also even the lungs. So we would expect to see, with the research coming through the pike, is that CBD is effective for helping lung disorders as well. So we're going to highlight the nervous system as represented by the brain. So to understand this endocannabinoid system, abbreviated ECS, here's a diagram of a human body, and you see where those colors are. That's where we have these receptors in the body, which means that these types of chemicals in our body are going to have some sort of effect. Now, there are different types of cannabinoids, and people have probably heard of marijuana as a beneficial medical substance, and they would affect this, but everybody knows that some of the downside of things like marijuana is it has the psychogenic effect. So the sweet spot for me in functional medicine, where we try to take a natural approach, is CBD, because it does not have those psychoactive parts, so it doesn't make someone high. But you can still get the benefits of the endocannabinoids by stimulating it with a supplement like CBD. Now, this is a pretty complicated slide, but it shows in the nervous system, it shows different disease processes. So I'll highlight a couple and then show you why this is useful to know. Pick some disease like Parkinson's or MS or Alzheimer's or epilepsy. So you see that there are neuroprotective effects that are occurring in here. So you'll see that over on the right, or antioxidant effects. And it tells the different types of receptors, so CBD1 or CBD2, or whether THC is effective in treating these. But so look at this from the standpoint of the benefits in the neurological system with disease processes. These are some of the big disease processes that plague us. And I also want to highlight at the bottom there, it says epilepsy. So the CBD and medical marijuana is known. There's actually some medications out that use this as a treatment for epilepsy. It is so strong, these endocannabinoids, and when we stimulate them. But so we see that in neurological conditions that we have improvement. On this particular slide, PTSD, epilepsy, MS, schizophrenia, insomnia. So those are ones that are affected with the neurological system. But then there's others too, and we'll see why, because the CBD is a regulatory system in the body, a little bit like the endocrine system and the hormones and the nervous system, and I'll highlight that in a little bit too. So how does CBD work? Well, these cannabinoids, and the CBD stands for cannabidiol, it the cannabinoids, which include CBD, attach themselves to what's called receptors in the body to make these effects. So there are two types of receptors called CBD1 and CB2 receptors. Now they're found all around the body, but for example, CB1 is found more in the brain, so that would influence things like coordination and movement, some pain, moods. And THC, that is in marijuana, that is the part that sets off a drug test, well, that is effective on these too, but obviously there's downsides to having THC in the body. The CB2 receptors affect things like the immune system, and we know for sure that inflammation and hyperimmunity are problems with these autoimmune diseases. So likewise, CBD would be effective in bringing down things like inflammation and also pain. And the bottom part of this says the CBD seems to influence the body's use of its own cannabinoids. And just to emphasize that, the body has this system already. So it's not unnatural to the body. It's actually tapping into the natural endocannabinoid system within the body and stimulating it or supplementing it. Now, we see a lot more of these diseases than we used to, and I suspect that our receptors are being injured by toxicity, just like a lot of our hormone systems are being influenced by toxicity. I think the endocannabinoid system is too, which is why we see so many of these diseases go up. So I want to highlight some neurological conditions that are helpful. So anxiety disorders. There's very nice research coming out on CBD helping so that people don't have to take as many medications. Things like post-traumatic stress disorder. So we see that a lot with veterans, so this could be helpful with that. General anxiety disorders. All of them throughout the anxiety spectrum are helpful when people take CBD. And again, the huge benefit on this is CBD, not only does it help these disease processes, but they also strengthen other parts of the body. So imagine that, instead of a drug that has a potential benefit, has a ton of side effects, this CBD can help alleviate some anxiety disorder in this case, but it also helps strengthen things like the digestive tract and the heart and the skin and the eyes. So you're getting double bang for your buck. So people should take this whether they have disease processes or whether they want to do it just as a health benefit. The next one that is in the category of neurological is depression. So CBD is shown to have an antidepressant activity in the brain. And it stimulates some of these chemicals. They all have long words, but like serotonin that we see a few times that influences moods and things like sleep. And then there's other receptors that make the body anxious or increase the activity called GABA that I'll highlight here in a second. But it seems to regulate those as well. So we see on previous slides that CBD can help with disease processes, so it decreases the symptoms of things like MS and Parkinson's and seizures, anxiety disorders and depression. And part of that is that it helps with the nervous system. It decreases the inflammation and toxicity. So in certain disease processes like Alzheimer's or Parkinson's or ALS, which is Lou Gehrig's disease, MS, which is multiple sclerosis, all of those have an inflammatory part to them that if that is decreased, it helps with the symptoms of those particular disease processes. So now let's talk about the specific on this. Now this is not a disease process, but when people do not sleep, their health is influenced greatly. In fact, as a functional medicine practitioner, one of the most important things I can do for my patients is to help them to sleep, because healing occurs during a sleep process, and many hormones are regulated by a normal sleep pattern. So when insomnia occurs, and insomnia occurs in a large percent of the population, and almost everybody that has a chronic disease has a sleep disorder. So what it shows is CBD or hemp oil, it helps regulate REM sleep so that people can get into a longer cycle of sleep. It also helps control things like stress hormones as represented by cortisol in the body. So cortisol is a stress hormone, so when it's too high, it would make the body unable to sleep or anxious, and so then the person not sleeping is going to have bad effects on their health. The other part on this is CBD is really, really safe. In fact, even medical marijuana is shown to be really safe as far as when taken as directed. But the CBD is even safer, and it has an effect on the body of sedation, which means that people are able to sleep. Now, the great thing on this particular product with Xendurance is there is a sleep product. It's called CBDeep Sleep. It's recovery sleep. Now, yeah, athletes should take this because athletes do better when they're in their normal sleep cycles. Their bodies heal better. But also regular people that are not athletes can take it if they're having a disorder of their sleep. And so there's a couple other nice complements in this particular combination. So the CBD is a hemp product, and there's a couple other ingredients in this. So GABA. GABA is the long name of a neurotransmitter in our body, and GABA is important to regulate anxiety. So if someone doesn't have enough GABA, they have stress and anxiety, so they're unable to sleep. And then the very last one on here is 5-HTP and tryptophan. Now, both of those are precursors, which means they convert into a neurotransmitter called serotonin. And serotonin in higher levels allows us to sleep. Now, in functional medicine, many times we put together a digestive program and a sleep program together because, like I said, majority of people have a digestive disorder and a sleep disorder. And serotonin is created in the digestive tract, so usually people that have gastrointestinal disorders, they can't sleep as well. But they're really part of the same problem. So this is an overview of CBD and its use in some neurological conditions, but specifically in sleep. And this particular combination, the sleep blend, has nice CBD in it to help people sleep, but it has a couple other parts to it, the GABA, the tryptophan, and the 5-HTP. And if you can help people to sleep, trust you me, they're gonna thank you. This is one of the most important things in health. This is Dr. Gary Tennant. Thank you for tuning in. We hope you learned something. If you'd like to learn more, please check back here for more information on CBD and its uses in health.